Technology integration into healthcare is the future of healthcare. A recently launched scheme by Government of India, which is ABDHM, Ayushman Bharat Digital Health Mission. It also entails a lot of policies which govern, digital ID of patients.
To Ashwini, are there particular tests that women should take post their 30s?
Yes, there are a lot of screening programs which are done in lieu of especially non-communicable diseases. And as far as particularly women's health go, so my recommendation would be screening for diabetes, which is by doing fasting and PP, blood sugar, HbA1c. Screening yourself for hypertension, which would be doing your BP, getting your lipid profile done. Barring that, you should get your thyroid levels checked once post your 30s, and most importantly would be breast and cervical cancer screening. So for breast, you should do a self-breast examination. You can get an ultrasound done. And for cervical cancer, there are multiple modalities. There's something called as a VIA that can be done, which is basically a visual examination of your cervical opening. And secondly is a pap smear that also can be done. So these are certain screening modalities, and you must screen yourself for that, especially when you have a family history or you are living in the risk factors.
Are there any particular tests that men and women should both take for their cardiovascular health?
Yeah, absolutely. As I said, cardiovascular health is completely dependent on your lifestyle, right? And I have already mentioned that we are living in an amazing lifestyle, sarcastically speaking. So we should do a lipid profile. You should do an HbA1c. You should get a screening for LFT, and your kidney function test can be done. You can monitor your blood pressures. You can get your thyroid levels checked. And for women and men both, vitamin D3 and calcium levels make a lot of difference. They govern a lot of metabolic functions in our body, and that is something like the Indian population especially, we are deficient in vitamin D a lot, and it also renders you to illnesses like diabetes. So a lot of people don't know that it is actually a risk factor. So you should get a vitamin D3 level done and calcium levels also done.
How frequently should men and women get themselves screened or take a regular health checkup?
Okay, so if you have a family history, I would suggest that 6 monthly is a good frequency to go about it. But if you don't have a family history, then I think once annually is pretty good.
Doctor, we've had a wonderful session with you, and I'm sure people who are listening to you, they're going to take back a lot of information about how they should empower themselves with good health. A message from your end to our audience and our listeners.
I think we feel that, the responsibility of our health is on our depending on the age group, is someone who is taking care of all the household chores, the lady in the house, or it is on the doctors, or it is on the government who's running all the health programs. But I feel that the first and foremost person who should take charge of health is you yourself. You need to actively make measures, you actively need to make modifications, you need to take active steps towards better health, which entails empowering yourself with knowledge and also making lifestyle modifications which will give you good health outcomes. So
very truly said.
My message is that your health is your responsibility, not anyone else's.
Absolutely. You have to be responsible for your health. You have to take care of yourself. Nobody is going to do that for you. You need to go and get yourself screened. You need to address those issues that you are facing, and never hesitate. It's your body. It's your right to address those issues. If you are healthy, you are empowered. Everything can be managed, but losing out on good health is a big loss.
Healthy India की trusted lab